from AVP of Specialty Clinic. So, before going into the prevention and other things, first of all, I would like to discuss the about the global prevalence of eye conditions. So, according to WHO, around 2.2 billion of people live with a vision impairment. In 1 billion cases, vision impairment could have been prevented or is to be prevented according to 2019 they have published. So they have divided into various categories like unaddressed presbyopia and refractive error, cataract, glaucoma, the corneal opacities, diabetic retinopathy cases, trachoma. Such categories have been mentioned in that study. So, in that, among a group of conditions are with visual impairment and another group without visual impairment. So, among the most common group of visual impairments, like the categories like cataract, corneal opacities, glaucoma, trachoma, age-related degenerations like macular degenerations, diabetic retinopathies, and also the refractive errors are coming under this category. While the other conditions without the visual impairment, like the inflammatory conditions of the eyelids, also the infections or the conjunctivitis conditions, and the most common dry eye cases, and the cyst and sty formation of the eye, and the benign tumor on the eye inside and both outside the eyelids, and the subconjunctival hemorrhage. So these are the two categories of eye conditions with and without visual impairment. So when we discuss about all these conditions, there are something which can be modified and which cannot be modified. So among the modifiable eye conditions, for example, the lifestyle related, for example, smoking and nutrition deficiency related conditions can be modified with awareness and also with a proper lifestyle changes. And also the occupational or recreational related eye conditions like activities or those who are working under industrial area. So with a proper care and for eye prevention can be done with a proper lifestyle changes and also in that occupational related changes. And also the environment related like hygiene, sanitation, access, all that can lead to eye diseases, and that also certain extent we can modify the eye condition. And also, there are some conditions which can't be modified, like aging, age factors, the age-related degeneration. Certain extent we can modify only in some conditions, but there are another some groups which can't be modified, age factors or the genetic factors. Certain regional related genetics cannot be, or some familial related eye conditions can't be changed, or ethnicity, some regional or some area, particular eye diseases can occur in a particular group of people, and that can be modified. Now, the main topic we are going to discuss, why Ayurveda and what the importance of Ayurveda here in Ayurveda ophthalmology or in eye care. So the first thing, we are utilizing the natural resources for uh, uh, prevention as well as the curative aspects. And another important point is that it conserves the human system. Whatever the treatments or whatever the precautions or the protocols applied, conserves the system or the without making any structural damage we are able to do. And it is executing at a preventive level. Majorly, a primary aim is to protect the vision rather than going for a curative level. So in Ayurveda, the relation between the general health and eye are very important. Why? Because the causative factors and other parameters are closely related. Likewise, the other systemic changes or hormonal changes or any other causative factor which lead to any health issues can also be a causative factor towards the eye diseases. And the diet and regimen which increases the pitta dosha. So according to Ayurveda science, eyes are the seat of pitta dosha, which is essential or responsible for the vision. So the vada, pitta, kapha are the three doshas. So the pitta dosha derangement, whatever happens due to irregular diet and regimen, the pitta dosha or the increased or aggravated pitta dosha move upwards towards the shiras or the upper extremities and cause the eye diseases as per Ayurvedic science. So these increased doshas move towards the eye structures like the eyelids, the sclera or the cornea or the retina, the anatomical structures of eye. And these variations in the dosha can lead to that particular disease in each anatomical structures of our eye. So next we are going to see the Ayurvedic management perspective. Likewise, I have discussed in the early slides that it can be a preventive as well as curative care, but majorly we are concentrated as a preventive care to protect the eye. For that, we have specialized treatments and medications with the help of natural herbs. So next, we are going to see that particular common etiological factors of eye diseases mentioned in Ayurvedic classics. So among them, the first one is exposing or drinking of cool water or cold water immediately after exposing to the heat. So here, what happens is the because of the immediate or opposite exposure, the climatic or the temperature variations, the eye muscles are getting strained, and that frequently habituated changes may affect the eye diseases. And another one point is looking at very distant objects regularly for a long time. So normally the eye can visual the things up to some extent or some distance can be visualized without any strain. So by seeing that far distance more than the capacity of the organ for a long time, so this accommodative capacity of the eye gradually loses or the vision is getting distorted and lead to certain eye diseases. And another topic or another point is abnormal sleep habits. So, according to Ayurvedic science, the day sleep increases the kapha dosha, and night arousal or lack of sleep at night can lead to vada and pitta dosha. So, all these three doshas should be in a balanced state. So, any of the doshas are getting deranged or imbalanced, certain dosha related conditions can occur. For example, the hyperemia or the redness of water or watering of eye or any edema on the eye or the strain and headache. These are the common symptoms occurring when there is a these three dosha imbalances. And another point is that continuous weeping or continuous excessive stimulation of the lacrimal gland happening through these, and the stamina of or the capacity to fight against certain diseases or any infections loses by the eye. And finally, the sensory organs getting a strain and finally can end up with the diseases that can make changes in the lacrimal apparatus or the lacrimation, and certain disease can occur. And another psychological factors like excessive anger, grief, stress, all that can also lead to eye diseases. Like the anger is responsible for variation in pitta dosha, or the excessive anger can make changes in the increase in the pitta dosha. So this pitta or this vitiated pitta cause pitta disorders or pitta related eye diseases. Grief can lead to excessive increase in vata dosha, and that vata related or vadaja eye diseases can occur in our eye. And another factor is stress. Stress is another, it can be a physical or mental exhaustion. Both the Sharirika and Manasika dosha, like Vada Pitta Kapha and Sattva Raja Tama, the Manodosha, also getting vitiated at a time, and or all the doshas are getting vitiated, lead to dreadful eye diseases. And another point is injuries. The external injuries can cause to severe contusions or any other damages to the eye. And if it is left untreated or if it is not taken proper care, it can lead to visual imbalance even. And another point is alcoholism. So alcohol, in according to Ayurvedic science, alcohol, the quality of alcohol is exactly different to the urges in our body. So when that the person is getting addicted to alcohol, there will be a depletion of urges in our body, so that it can lead to certain eye diseases, because eyes are considered as the seat of tejas or the pitta, and the ojas also situated there. So these variations in the ojas can lead to vision related issues, and also the suppression of natural urges. So, according to Ayurvedic science, for any diseases can occur due to the suppression of natural urges. So, normally what happens is when there is a suppression of the natural urges, increase the Vata dosha in our body. So, the Vata moves towards the upward direction in our body and can lead to the shiras or the upper extremities, and it is leading towards the eye diseases. And another point is excessive fermentation or sedation. So, in the diseases like sty, salation, or small growth and all, mild warm compress or fermentations are advised. But if it is done excessively, that can cause pitta and rekta vitiation in our body, or the body heat, or the heat is directly affecting to the sensory organ. And the exposure to the smoke or usage of tobacco, like if a person is excessively exposing to the smoke, the allergic factors like smoke and dust can make a excessive response from the organ as well as from the immune system, and can lead to certain kind of allergic diseases. And also the tobacco is most terrible nowadays. It is causing the diseases, for example, like um, uh, degenerative conditions like macular degenerations. uh, One of the major issue of loss of vision in that category of people. And the suppression of vomiters. So when we suppress the vomit, the reverse pressure happens in our uh, airway. The upward movements of vada happens. So this sudden upward movement of vada can make hemorrhages or bleeding in the minute capillaries inside our eyeball. Also, there is one therapy known as Vamana in Ayurveda or emesis therapy. So, if it is done improperly, the same what happens when you suppress the vomitus, the same thing happens when you do the emissive therapy improperly. That can lead to minute bleeding or hemorrhages on the conjunctiva, or even retina can be impaired, and even it can lead to vision loss. And another point is suppression of the tears. When we suppress the emotion or when we suppress the tear, the doshas are, or these vitiated doshas are obstructed in the nasolacrimal drain, or in Ayurveda it is known as Ashruvaha Srodhas. And that can cause the eye diseases. The over response will be there in our sensory organ, and ultimately that can lead to that dosha vitiation, and according to that particular dosha, that particular diseases are arising. And another one positive factor is observing a minute object for long duration. So it creates a lot of strain inside the ciliary muscles inside our eye, as well as the lens, intraocular lens, and it can lead to problem with the accommodation, or that visual problem, refractive error can happen. And dust exposure. Likewise, the smoke we have already discussed. The dust is one of the common allergic factor. So those who are allergic, or those who are allergic to dust and pollen, when they are exposed towards the dust, it can make a sudden changes in the immune system, and the immune system over responding towards that factor, and the eye can cause a severe allergic eye diseases. And not following the health principle of Ridhucharya. According to Ayurvedic science, every season has to be done with a particular diet and regime. So when there is an improper changes, or improperly we are undergoing for change, uh, seasonal regimen, certain disease can happen. For example, if a person is having hot water during Ushna Rudu or summer season, ultimately the Pitta vitiates, and that Pitta related eye diseases can happen, or the heat is increasing in the eye, and that related diseases can happen. Likewise, if another one example, if a person is having cool water during that winter, uh, or winter season, or a rainy season, the kaba is getting vitiated in our body. So the kaba related eye diseases can happen, like heaviness of eye, or pain inside the eye, or lacrimation. Such things can happen. And exposure to the hot producing factors can lead to vitiation of recta or blood and pitta. So all these particular same qualities can end up with that particular dosha related eye diseases. So these are the most common Ayurvedic causative factors mentioned, and I have described from Ayurvedic classics. And according to the modern science, the etiological factors, they are divided into prenatal and postnatal. For example, prenatal, hereditary, or congenital can happen. So there are some familial related genetic reason, maybe the reason for some eye diseases. For example, if the parents are blood related, the upcoming generations can develop that eye diseases, like diabetic, sorry, not the diabetic retinopathy, retinitis pigmentosa, or another one complication is known as color blindness. So these are hereditary or congenital. And postnatal group, that are physical, chemical, or mechanical, or parasitic external factors, like injuries. So these all can happen due to if the injuries are not treated at the primary level, it can lead to vision issues, or vision loss can happen. And the degenerative disorders, likewise, we have discussed before regarding that excessive use of alcohol or tobacco can lead to that degenerative condition. For example, that macular degeneration at the early phases, it can happen. And another conditions like a growth cyst, or tumors, or minute abscess. These are the most postnatal related, or after the birth, the person can affect with that category of eye diseases. So let us see what are the pre-manifestation symptoms in every, or group of eye diseases. Most common features, like eye with it may be a primary symptoms, or maybe that an alarming towards the upcoming diseases. For example, the watery discharge, or eye will be watery, along with itching sensation, or stickiness, or heaviness of eyelids. Heaviness of eyelids happen when there is a kapha increase inside the eye, and burning sensation, pricking pain, or hyperemia or redness inside the eye, or foreign body sensation, and associated with the blurry of vision. So these are the most common manifestation symptoms in common that are common in the eye diseases. Or if the person is having any difficulty in closing and opening the eyelids, that also one of the common pre-manifestation symptom. So let us see what are the preventive care in Ayurveda. So likewise, we have already discussed avoid the causative factors. That is the primary level of treatment in Ayurveda. So if the causative factors are known, it is easy to treat every time. So if it is a non-causative factor, that should be avoided, and avoid the use of addictions or like alcoholic or drugs or smoking or any other additives. And also, it is advised to follow the daily routine or dinacharya as per the Ayurveda. Follow the daily routine mentioned in the Ayurvedic classics from the moment you wake up till you go to your bed. There are a group of regimen mentioned by Ayurveda. So that should be followed to avoid the eye diseases as well. And also the seasonal regimen. Follow the detoxification measures mentioned in every season, like the therapies like emesis and purgation, or when there is an issue, the dosha or the body should be evaluated and from an Ayurvedic expert, and particular elimination of dosha should be done with the help of uh, purification or panchakarma therapies. And another one is to maintain the personal hygiene. It is always important to maintain the personal hygiene to avoid any other kind of external factors like that infection and other allergy factors, etc. And also to have a proper diet habits. In Ayurvedic science, it is advised to include the old rice. Old rice, it's very good for the general health. Why? Because it is easy to digest, and also it will be preventing from increase in the or derangement in the three dosha. Old rice or old wheat and use of red rice can be done in your regular diet for your for a healthy weight. And use of green gram, ghee, pomegranate, and use of grapes also advised by Ayurveda in your diet. And when it is coming towards the non-vegetarian diet, the use of martial land animals is especially mentioned in Ayurvedic classics because these kind of meat are easy to digest by the body, and that will not make any immediate increase in the three doshas. And another one point, according to Ayurveda Acharya, they have mentioned that to wear the head cover or cap when you go outdoor to avoid that further external factors that can affect the vision. And the most commonly used drug in Ayurveda, in Ayurvedic ophthalmology, is tribala. Tribala means that three combination of, or the combination of three fruits, that is haritaki, jipitaki, and amelaki. That can be used along with that ghee in our daily, that can be added with our daily diet, can avoid from eye diseases, or it can prevent from certain eye diseases. And the purificatory therapies, likewise, I have mentioned emesis therapy or vamana, or purgation therapy or bloodletting therapy can be done according to the dosha evaluation done by a Ayurvedic physician. And Nasya is another one, daily routine advised by Ayurveda. It is nothing but that oil installation, nasal installation of done by medicaments or medicated oil every day in the morning, that which strengthen the sensory organ or the eyes. And also Anjana or application of collyrium. It is a traditional practice in our culture that to apply the Anjana, that is cleansing the sensory organs, or it is stimulating the eyes, and it is protecting the vision. And among the diet habits, there are another particular points to be remember when in terms of habits. So according to Ayurveda, do not have food when there is an indigestion. So when there is an food intake, when you are already having that indigestion, and it can lead to increase or derangement in the three doshas, and ultimately it can end up with eye diseases also. And do not have food before the previous meal get digested. So these are also another one more point to be remembered, because when there is an indigestion, or if the previous meal is not already digested, again it can lead to dosha vitiation. And avoid food items which are heavy to digest. Okay, always prefer the meal which are easy to digest, and also do not suppress the natural urges. And another one important point is that oil applications on the head. So head oil applications most closely related with our culture. So regular application of oil on the head can protect the vision. And with the help of medicated oil in Ayurveda, there are certain therapies like Shiro Abhyangam or that head oil massages. Shiro Vasti, another one treatment is there. Shiro Dhara is there. And Shiro Piju, another one treatment is, or oil pack is there. So all these treatments are doing with the help of medicated oil, both preventive level as well as curative aspect. And the importance of Tribala in Ayurveda eye care, because uh, this Ayurveda denotes the Tribala is most commonly used medicine in ophthalmology. It is used as a combination, as well as it is added with the other processed medicine as well, in various types like a decoction, powder form, paste form, or ghee preparation. So, I would like to explain another specialized treatments also in Ayurvedic ophthalmology. So, there are a group of treatments that will do the prevention as well as the treatment aspect. So, the first one is known as netra sekam, or pouring that medicated decoction on the closed eye. These are used as a preventive care in cases like dry eyes and so many other diseases, as well as a preventive care likewise to protect the vision with the use of medicaments like tribala or milk decoction are also being used. And Ashwagandha, this is nothing but that nasal eye drops, medicated eye drops. Normally, what we are using to treat in the present era in Ayurveda, it is known as Ashwagandha or the medicated eye drop. And Anjanam is another one procedure. It is nothing but the application of collyrium or the application of kajal. So in Ayurveda, the Anjanam application, it is mentioned in a daily routine or dinacharya to maintain the eye health. And here you can see Bidalagam or external application of the medicated paste on the closed eye. You can see the medicine are applied to the external skin or eyelid, most commonly used to treat or relaxing the eye, as well as to prevent from further changes like opacities or swelling, like a stye, chalazion. Such condition also used to treat with this particular treatment method. Pindi, or this is known as the medicated bandages of the eye, most commonly used to treat so many conditions like any kind of swelling or any other conditions. Like in glaucoma, we are using this treatment to prevent the eye as well as to protect from certain diseases, or it is used to treat in certain conditions. So another one procedure is known as tarpanam. Here, the unctuous substances, or the most commonly we are using the medicated ghee kept on the eye for a specific time. So this method we are using to treat in certain conditions like refractive errors, or in some other cases like retinopathies or any kind of degenerative conditions. So basically, this procedure is rejuvenating the eye with the support of medicated ghee. So these are the common treatment uh, or specialized treatments mentioned in Ayurveda science to treat or as well as to prevent from eye conditions. So ultimately, to understand the dosha or to understand the condition and select whatever is supportive towards that condition. But the prevention can be done at the primary level, and curation or the curative aspect can be decided with the help of these group of therapies in Ayurveda. So today we have discussed the prevalence of eye conditions globally and the eye pathologies or the pathologies that can lead to eye diseases, and how to protect the eyes from other diseases, and also the certain treatment methods what we are using to treat certain conditions. So, I would like to highlight that future directions in Ayurvedic ophthalmology to highlight the possibilities by using natural methods or by preserving the system. So, here today we are considering this webinar with these points, and thanks for hearing.